Okay. Hello, I'm Dr. Irene Dimitriou. I'm talking with Christopher Drake, our senior practitioner and founder of Learn Buteyko Online. And Christopher, I would like to ask you today, what's your experience on cystic fibrosis? Can this be reversed? Can this be helped? It's a major issue for many people.
Yeah, it's very difficult to treat. In adults and even with teenagers already, it's getting very. It depends how serious the case is, but they can get relief very quickly. Things can improve very quickly, but it's quite a deep disease, and the bronchus actually rots away, becomes broken up because of the excessive mucus production.
Yes.
And
it's not really in the chronic disease spectrum, right? It's a congenital condition.
Yeah, it's congenital, but I found with small children, it's very easy.
Really?
Yeah, I mean, they just join in with the asthma kids, and they have no more mucus, no more coughing. Everything rectifies very quick. That's what I saw. Now, I'm sad to say that we didn't really follow up, because back in those days, this child is taking asthma medications, small kid, 5, 6 years old. They're coughing all the time. They have mucus production, all the terrible business. The parents have been given the diagnosis of cystic fibrosis, and I don't know, we just put them in the class with all the other kids, and the symptoms all came off very easily within a very, as usual, a week or two, and the symptoms are vastly improved. Now, what's the long-term effect? I have really no idea. But I do know that we had a few teenagers and some adults, and we got a lot of improvement, but the stages or depth of the disease. And so it's like a pendulum. They get better and better and better, and then something gives way and it collapses a bit. And we work again to try to improve the situation. And again, they get some infection or something. And there's these issues with they don't produce enough enzymes, or not enough of the, digestion problems. So, I think it's possible. I think it's doable. But, the people, the doctors and the parents and the patients are very much acclimatized this being to incurable disease.
That's true.
And one of the very sad things or difficult things, sometimes a parent has their child learning this method. They're very happy that they get some positive results, but they're unwilling to push them enough to keep on going to the level that's necessary, because they're under the impression that they're not going to live long anyway. So they don't want to make
life difficult.
Life, miserable, more miserable than it has to be. That's not making a judgment on the parents. I can completely understand that. And I also know that the doctors and the people in that world are quite fierce. You have to do exactly what you're told. And we often say, look, why take these bronchodilators if you don't need them? And they put them on these long courses of antibiotics, which Buteyko didn't agree with. So our approach is different from the traditional approach. And Yes, we get some good results. They always saw good results. But for those people who are older, you know, young adults and so forth, yeah, we didn't always, you know, so now, like if in the past, if someone had that condition, I'd say, yeah, Buteyko method is a right approach. I think it's a right approach. And I know that when they start to practice, they're going to see some good results. But I also know now that, you know, at a certain point, there'll be rebound and they'll have to work even much more harder. And, you know, they should be prepared for that.
For hard work, eh?
I mean, really, like, you know, and it actually comes a point, you know, when you sort of think to yourself, well, you know, they suffer a lot. They suffer a lot. It's a very difficult disease to treat, and they suffer a lot. So, but small kids, I wish I don't even know where they are now. The workshops, we wouldn't even have the records now, going back 30 years ago. But it was quite something, you know. This was in the US in particular. And they did the little kids, they did the course like all the other ones. They stopped coughing.
Sorry, I've lost the connection.
No, it's back again.
It's back again, yes.
You know,
I suppose that the method helps the mucus become less viscous and be expectorated more easily.
Oh, yes, it does that. But also, it's mainly the glands that produce the mucus, you know. They don't produce as much. They produce less. Because the mucus is protective. They see it as bad, but it's actually the organism, you know, overcompensating. But it's a protective measure. And as the level of CO2 improves, the requirement for the mucus becomes less. And so the body reduces it and the glands somehow normalize and they have much less mucus. But, you know, like I say, the difficulty and to stay on top of the situation is quite rigorous.
Yes.
You know, and I've had cases, you know, where, you know, there's some teenager and they're doing their high school exams, a tremendous amount of pressure, and then social things which are happening, and all they want to do is live a normal life, you know, and then they get a chance to live a normal life because the method made them feel a bit better and so forth. And of course, who can blame them? You know, they're diverted away from their practice. And then, you know, and so just at the time you really need to knuckle down. I mean, certainly if I was talking to parents now, I would do it differently, I'm afraid to say. If they were a young teenager, I'd say, you know, stop school, give up school. Focus on this and nothing else.
Yes.
But with because that's the application required is really quite intense.
Yes.
You know, so I'm really, you know, but small kids, 8 years old, 6 years old.
So the younger, the better they are trained. Great.
It's easy, you know, like, and I remember, you know, talking to them afterwards and the parents were just like, well, we don't know. What do we do now? I just said, well, just keep them doing the exercises.
Yes.
You know, it's not a big deal. You know, they know how to do them. And, you know, and as far, no, I don't know. Did they keep it up? I don't know if it developed into something, you know, later on in life. I have no idea. But I do know that all the symptoms stopped. And he was just talking weeks. But with those ones whose case is more serious, well, I would still recommend it. I would say, yes, do it. But it's not like asthma. It's not like high blood pressure or migraines or chronic fatigue or one of those conditions. It's something which is much more difficult to treat, takes longer, there's rebound that you have to deal with, and it requires a level of commitment that, you know, I'm pretty sure it was some ignorance on our part. We didn't tell them the commitment that was required because we didn't know.
Yes.
You know, we know what to do according to the circumstances, and we can show them, and it invariably works. But, you know, how long does this go on for? You know, how long do they have to practice? You know, do they ever get a break? Or, you know, these are the things which are, you know, hard to, we still don't know enough about it. You know.
Yes. It's a solution though. Thank you.
Like I said, if someone had cystic fibrosis, I'd say yes.
Yes.
This is a good approach. This is an effective approach. You'll see results. If they're a small kid, expect very good results in a very short time. If they're a young teenager, depending on the severity, depending how advanced the condition is, depending how much damage has already been done. Sometimes they might escape quite easily. I would imagine so. But we had a few cases where that wasn't the case. They got initially very positive results. They were very encouraged. We were too. I thought, this is good. This is good. And then a few rebounds, then infections, and then having to start again, you know, and I think to some degree, they got worn out by it, mentally worn out by it. And of course, the parents, you have to sort of think about them too. They're just been told by the doctors, this is not curable. And they have to see their child suffer and suffer and, you know, live quite a miserable, in a very miserable situation. And they're trying to make that situation as comfortable as possible. Of course, they're looking for a solution, of course. And then they bump into us and we say, oh, look, you know, practice these pauses, do this, do that. Okay, they do. They see some positive results. This is good. And then comes some, because they go into cycles. The winter season comes and they get infections and then everything crashes down again, you know. And then you got on the one side, the doctors who told them there's no cure for this, there's no cure. And they must take all these dilating medications and, okay. So, you know, it's, our approach is different to the doctors, and sometimes the doctors are very strict, quite authoritarian about it, which I can understand. I mean, I think they believe what they're doing is right. I don't, you know, I'm not being critical, but it's just two different approaches. And on our side, our shortcoming was we weren't, well, at least I wasn't, experienced enough. I thought I was, because we saw it with the small kids, very easy. And then we saw it with older people, but they stopped practicing. And at first, I'm sorry to say, we might have even sort of blamed the patient a bit. Oh, they've stopped practicing. Well, you know, but we didn't probably realize how tough it was, you know.
Yeah.
So what I would say is, if you're, you know, a teenager and the condition is at least moderately severe, you should practice Buteyko method, yes. And also I would suggest to parents very respectfully that their health comes first, and all other stressful things have to be taken off.
That's
no
right.
school, no social, whatever, just like practice, rest, practice, you know, to effect a treatment which can give them some long-term benefit, which I still think would come. But yes, I tried to explain what I know about it. Yeah.
Yes. Thank you very much.
You're welcome.